Dr. Jeff talks love, Dr. Jeff talks life, answers your questions, cuts through the strife. Sex and intimacy, real and true, evidence-based, made just for you.
Hello, welcome to Dr. Jeff Talks about sex and intimacy, where we explore the science, the soul, and the lived experience of sexual wellness. I'm your host, Dr. Jeff Albaugh. Today, you're joining us for episode 51, Unapologetically Sexual, Reclaiming Female Pleasure and Power. Whether you're watching live or listening on the recording later, I just want to take a minute to sincerely thank you for being here. I truly appreciate every single one of you listeners. Your engagement, your curiosity, and your willingness to learn are what makes this podcast possible. So thank you so much. We are connected across so many platforms. We're on Facebook, we're on YouTube, we're on X, we're on LinkedIn. If you're joining on X and want to submit a question, hop over to YouTube, LinkedIn, Facebook, or StreamYard so you can interact with us directly. A quick favor, if you are on Facebook and you're a follower, follow us. The more people who follow us, the more we can do on Facebook. So please follow us on Facebook. If you haven't already, please visit the website. The website has all the past episodes, 50 of them. Tonight, 51 of them. And you can learn more about all kinds of interesting topics. We have had the most amazing experts on. Please go and look at any of those past episodes. If you want to see what's coming up next, the calendar is where you go, and you can see all the things that are happening through March. And we have some amazing, really cool experts and topics for you to enjoy and explore. So please go to the website. You can also take Dr. Jeff wherever you're going. When Dr. Jeff talks about sex and intimacy is there, when you're working out, when you're on your road trips, take us with you. We are on your favorite streaming music service like Spotify, like Amazon Radio, iHeartRadio. We are out there and we will go where you go. If you're working out, let us work out with you. If you're going on a road trip, take us with you. Learn more about sex and intimacy so you can enhance your one beautiful, fabulous life and relationships. As always, I would like to remind you that all are welcome here. Whatever your sexual orientation, your gender identity, or your relationship style, we are so glad you're here and you are so welcome here. The mission of the podcast is pretty simple. It's to empower and enlighten you, listener, with the evidence-based information that improves your sexual health and deepens your relationships so you can live your one miraculous, wholehearted life with more love. That's our goal for you. That's it. That's the mission. What about today's episode? I'm really looking forward to this episode. It's an important and empowering one. It's episode 51 is really about reclaiming female pleasure and power. For far, far too long, female pleasure has been minimized, misunderstood, or medicalized without truly being honored. Tonight, we're going to honor it. Pleasure isn't frivolous. It's not optional. It isn't selfish. It's central to health, identity, and agency. And in this episode, we'll talk openly about what it means to reclaim pleasure, to reconnect with the body and step into your sexual power, especially in a culture that often teaches women to prioritize everyone else's needs first. We'll explore how trauma, shame, hormones, relationships, and healthcare experiences can disconnect women from pleasure, and how healing, education, and self-compassion can help restore that pleasure. I'm thrilled to be joined by someone who brings both clinical expertise and deep respect for women's lived experiences. I can't think of a better person to join us than Aleece Fosnight. She is a nationally recognized physician assistant specializing in sexual medicine, women's health, and pelvic health. She's a certified sexuality counselor, a member of the International Society of Study of Women's Sexual Health, ISWISH, and an outspoken advocate for pleasure-centered, trauma-informed, and inclusive sexual health care. Aleece works at the intersection of medicine, embodiment, and empowerment, helping women reconnect with pleasure, with desire, and their sense of sexual agency across all lifespans. Through her clinical work, education, and advocacy, Aleece challenges outdated narratives around female sexuality. And there's plenty of those outdated narratives around female sexuality. And she encourages a model of care that centers pleasure as a vital sign of health. Her work reminds us that pleasure is not a luxury, it's a birthright. She has her own clinic that she built from the ground up that's very exciting, and she is a wonderful practitioner in person. And I can't thank her enough for joining us and sharing her expertise. Aleece, I'm so glad you're here with us. Thank you for joining me.
Thank you so much again for having me, Jeff. I'm so excited to be here again, and especially talking about such an important topic.
Well, without further ado, I can't wait to hear what you have to say, so I'm going to hand it over to you in its entirety, and it's all you now.
Awesome. Well, I'm a sucker for a PowerPoint presentation, so I do have one for you all today. I'm also a very visual person, so I think being able to have that is really key. And as Jeff so eloquently introduced me, everything that he said is what we're going to talk about today, and really helping to reclaim female pleasure and power. Now, this is a short presentation, so my hope for you all is to get a little bit of information, but at the very end is that this is your permission slip. That if you are struggling with owning your identity, owning your pleasure, being able to take back your power just in who you are, I think it's really important to understand that while we are talking about kind of like the sexual side of things, it's really more than that. And understanding that sexuality is who you are as an individual, it's how you move through the world and your relationships. And that my hope is that, again, you're giving us a little bit of permission slip today to do something different, do something for yourself, and to really evaluate what you are currently doing that may not be working and that you want to change things up. Just like Jeff talked about is, again, kind of this pleasure piece of it, but it really isn't about, like I said, being more sexual. It is around having choice, around having agency, and around having embodiment of who you are and what your desires are. These are my disclosures. I think it's important to understand those, that I'm a medical advisor for arousal urology, and I'm a medical consultant for Uberlube. And that the terms today that we're talking about with female, women, she and her do not fully encompass all of the individuals that we are discussing in this presentation tonight. Why does this conversation matter? When we're talking about female-centered pleasure, it still is very much under-researched, right? We know that women were not included in studies until 1993, that women's bodies and women's pleasure is still very much controlled by society, and that when we think about it from a evolutionary standpoint, what does female pleasure give us, right? We're thinking a lot more on the reproductive side of things. We're thinking about the uterus. We're thinking about the vulva. But women's pleasure is much more beyond just the parts and pieces of an individual. And looking at what that could look like may seem very foreign to so many individuals. And again, it's very deeply misunderstood. When we think about pleasure and regaining pleasure from on a daily basis, when I touch a patient, it is really helping them to understand outside of the sexual boxes, right? When you are sitting at the breakfast table, sipping your coffee, for that first sip of coffee, if you're a coffee drinker, or if you for that first sip of tea or whatever you're having in the morning, whatever your beverage of choice is, right? That first sip, there is nothing like that's pleasurable, right? So it's finding the pleasurable pieces every day outside of the sexual side of things. Now, when we are, again, also thinking about this conversation, is pleasure is often the first thing that is sacrificed in a lot of female identified individuals when they are under stress, when there is trauma, when there is caregiving, when there is illness, and even when there are menopausal changes. We're thinking about the hierarchy and how we triage our priorities, and pleasure is often the one that gets kind of kicked to the side a lot in those situations. Now, again, I kind of alluded to this a little bit, but we have to remember that sexuality does not equal sex. And when I say sex, a lot of people think about the types of sex that they are having, but really it embodies so much more. Again, it is identity, it's the relationship that you have with your body, the relationship that you have with desire, right? This rawness, this want, this craving, and then again, relationship to power. And that power also being control over your decisions. And remember, we talked about, why we're talking about those conversations, because women's pleasure has often been very controlled and minimized, and we have not been able to have a lot of our own control when this happens. The other thing to bring to your attention is also that pleasure does not equal performance. I'm going to bring another P into this mix with pleasure, but we talk a lot about pornography and how that is very performative, and that is not realistic, and that is not typically how sexual encounters occur. And being able to talk through that and what that looks like, but that's a lot of people's sex education. It's a lot of the first things that they see when they're thinking about sex and relationships and the way that people interact with one another. So being able to understand realistically what is happening is one of the first things that we talk about, especially in my patient encounters. Now, where did we learn this disconnect? Again, a lot of this had to do with, again, pornography, and that is very, again, much performative. And for men's sexual pleasure, we know that a lot of heterosexual women that are watching pornography definitely say that it is not realistic or representative of what they really feel like a sexual encounter looks like. And then it is very much exclusive of other identities and doesn't embody queerness or gender diversity within a lot of the pornography that is available, and it's not ethical. We talk about that whole thing. Maybe, Jeff, that's a whole other topic for us to talk about, is pornography and ethical porn. But when where are we learning this? And Jeff definitely talked about this at the beginning, is that it's these cultural messages and societal messages. That again, it is that sex is and pleasure is there for us to perform, and it's not for us to feel. That it is to be desirable and not desiring. I talk a lot about the objectification of women and women's desire to be chosen rather than to be the one who chooses. And then the last one here is for us to tolerate and not enjoy. The amazing thing that research has shown us too is the differences between heterosexual relationships, and I'm going to talk about that first, but the orgasm gap. And Lori Mintz is an amazing sex educator and researcher and therapist, and she talks a lot about the orgasm gap, and a lot of it kind of has to do with these cultural messages. But when you talk to a heterosexual male-identified individual, and when you ask them the last time that they had a sexual encounter, did they have an orgasm? And about 98% of them say, yeah, I sure did. When you talk to the heterosexual female identified, which is typically the partner of this person, only 68% of the time they will say that they had an orgasm at their last sexual encounter. So there's this huge gap that is happening, and where does that occur? And a lot of sexuality and pleasure has been very male-centric and penis-centric and penis-focused, and not necessarily on the female-identified individual. And that this really, based off of research, is something that is learned. This disconnect is really not innate, that everybody deserves and desires pleasure and to have a satisfying, pleasurable experience when they are connecting with either themselves or another individual. Having these conversations, and you may be thinking this yourself as you're listening to it, but Aleece, that was just something that I I was taught, or that I thought that sex was supposed to hurt, or that I was doing this for my partner. And again, those are learned behaviors that we are getting these messages from our socio-cultural world around us. What about the cost of disconnection? And when we see pleasure being suppressed, we see a lot of pain, and a lot of this is pelvic pain. There's a lot of low desire. What I tell my patients and how I think about this is pleasure is something that is a positive reward. Our body wants to keep doing the things that feel good. If things don't feel good or they feel pressured, your body really doesn't want to do those things anymore. That's an innate thing. That is in your body, that is in that brain. There is a book called The Body Keeps Score, and that purely talks a lot about how our bodies remember, and it prioritizes it. It is in survival mode. Why would it continue to want to do something that hurts and doesn't feel good? So if sex causes pain, and if at one point the desire was the thing that led to the sex that caused pain, I'm going to suppress the desire. So again, we see that desire go down. We see difficulty with arousal. We see a lot of shame, dissociation, and numbness associated, and relationship strain. There's a lot of miscommunication, desires, and the expectations of what's supposed to happen in there can be mismatched and can cause a lot of difficulty within that relationship. And if that's causing difficulty, then the stress and the trauma is pushing away more of that pleasure and more of that desire. So it's this vicious cycle that we see a lot when we are suppressing the pleasure centers of our brain and of our bodies. And this is something, again, that we cannot ignore, that we need to have conversations and bring to light what actually is happening. We talked a little bit about your body remembering, and your body also remembers that pleasure is a form of power. And I love this piece of it. I think I need a t-shirt that says this, or some bumper sticker, right? But pleasure is a form of power. We know that when there is pleasure in the body, you can think about like sipping that first cup of coffee or whatever else. Do you feel really agitated or nervous when you have that pleasurable sensation? No. Your nervous system is nice and regulated. You're in kind of this rest and safety mode and this beautiful parasympathetic nervous system. Then we also understand too that there's boundary clarity. I love a good boundary. My sex therapy colleagues would be super proud of me for having this in here. But boundaries are so important. And for female identified individuals, boundaries are tough because we're supposed to be people pleasing, we're supposed to be very passive, we're supposed to just do what we're told to do. And so having that power to create a boundary and the clarity that goes along with it can be really difficult, but it's so essential into, again, owning it and having control over your pleasure. And then it also allows for self-trust. I hear this a lot with my patients, is that they don't trust themselves, meaning that they feel like they've been deceived, their body has deceived them, and so there's this disconnect even with themselves. So being able to talk about pleasure and have pleasure in your life does enhance the self-trust. When also somebody can have pleasure and they don't have pressure, they actually have the ability to say no. And that could be really difficult when you are in that people pleasing, is if your partner is feeling, or your partner is pressuring, or it's saying things of, well, I thought you loved me, and why don't you want to do this for me, right? It's not just always for the other person. This is a relationship, and this is a partnership, and everybody has to have consent in this, whether the other person doesn't like it or not. If somebody is saying no, that is their issue, and that should not feel guilt on the person that is setting that boundary. So that's really a tough one, and encourage a lot of people to talk to a mental health therapist to help work through that. And that is an ongoing and evolving thing to work on. Trauma-informed pleasure. At our office, trauma-informed care is actually part of our core values. So when we talk about trauma-informed, that means, again, that you have choice, that there is pace in the activity, that you feel safe, and the consent. Consent is a non-negotiable for us in our practice. We do a lot of pelvic exams. I do a lot with people that are experiencing pelvic pain. And again, so important to have that awareness and those boundaries and that continuing ongoing conversation with the patient. Just because somebody walked in and said, yes, I agree to the pelvic exam, and we get to the point where I'm saying, okay, are you okay for me to uncover and to take a look? And they're like, actually, no, that's consent. I'm respecting that. And we're going to say, okay, no big deal. That's totally fine. I see this a lot in relationships where somebody said, well, they liked doing it the time before, and I don't understand why they don't now. You have choice in the matter, and you can choose to do something different. This is the same thing when it comes to food. And I love Al Vernacchio's Sex as Pizza example, and we'll say this to a lot of my patients, is just because you had pepperoni pizza last week, are you in the mood for pepperoni pizza this week? Maybe you want something a little bit different. So the assumption that your partner wants pepperoni pizza again this week is not a consensual one. Again, it's choice in the matter. We still need to ask and get permission and invite that person into that conversation with us. Some of the common myths that I challenge on a daily basis is that low desire means that something is wrong. A low desire is a vital sign. Low desire is a sign of something that is going on in your body and is something that we should investigate and figure out what's going on. It doesn't mean that you're broken. It doesn't mean that something's wrong. It doesn't mean that it's a problem, right? A problem means that something needs to be fixed. And low desire for me, when I'm talking to a patient about it, doesn't mean any of those things. It is more for us to be curious to figure out what's going on with you and your body. The other myth is that pain is normal. I hear this so often. Pain in your body is never normal, no matter what it actually looks like. And again, is another sign of something that is going on that we need to investigate. There is also this myth that gets said to women all the time that pleasure is selfish. That, again, the messaging is that women should be givers and not necessarily receivers. And you can have pleasure with giving, totally fine, but there is a point where there has to be some back and forth. And again, it has to be that consensual piece of it. And so giving that permission slip and saying that pleasure is self-full, so changing the script is really important. And you have to feel fulfilled in order to be 100% present in that relationship. And then I also hear that women are really struggling through the menopause transition and the identity loss that goes along with it. And that, again, is the sociocultural messaging that happens, that you have to be young and beautiful and vivacious, and that when you are no longer reproductive and your uterus doesn't work and your ovaries are not producing eggs anymore, that somehow you are no longer worthy to be on this planet. And that drives me bananas. We have to move beyond identifying women with their reproductive parts and pieces. And we also know that they aren't just reproductive pieces. The cervix is the only organ in the body that is innervated by 3 different nerves. It is a huge pleasure center, and a lot of people get pleasure with cervical stimulation. The uterus helps to keep the pelvic floor and the ligaments and everything supported, as well as like your pelvic floor. It's there for a reason. And to have a hysterectomy or remove it just because is not a valid reason. So being able to help transition through menopause and the changes that are happening on the hormonal side of things can be really helpful in identifying where people might be feeling a struggle or feeling maybe that they are needing some hormonal support to get them back to feeling like themselves again. That's probably one of the most common symptoms that I hear from my female patients is I just don't feel like myself. And so being able to support them through that can be a game changer. Okay, so how are we going to do this? So reclaiming pleasure is not performative, okay? If you are faking your orgasms, if you're faking arousal, if you are faking libido, it is not doing anybody any good, and we need to stop doing that. The other thing is we have to remember that orgasms are on demand, right? There's going to be this buildup. While I think orgasms are great and those should be a part of your sexual health plan with your partner, it doesn't mean that if an orgasm didn't happen that it wasn't a satisfying sexual experience. So it can't be this performative orgasm goal focused only. It's not also about being sexier. That is the performative piece of it. That's the objectification of women and the appearance that is happening there. A lot of my patients, once we have these conversations and we talk about confidence, and there is nothing sexier than confidence. And you cannot have confidence if it is performative. So being able to figure out where can you feel confident in that space, in those pleasurable activities. And then it's not about keeping up with everybody else. And this can be in the relationship or what you're seeing everywhere else, or what is happening with your friend group. There's a lot of conversations of, oh my gosh, I'm having sex sex 3 or 4 times a week, and I'm having 8 orgasms every single time. Comparison is a thief of joy. So we cannot do that either. We have to figure out what feels best for you, and what is practical. And so again, practical reclamation, we want to be able to start small with small wins. So I love reconnection and reconnection exercises where we are, and this is with you, not just with a partner, but being able to hone in on what feels good in your body. So many women have not been afforded the chance to figure this out, what feels good in your body, and a lot of people haven't. But this is a great way to start, where we're talking about sensation awareness. You're, again, being very curious, not good or bad. There isn't good types of sex and bad types of sex. It's being curious about the types of sex that are out there and what can be on your menu, or maybe is off your menu, or what's off the menu for right now, but maybe back on the menu a little later. And then it's permission. I have actually note cards in all of my rooms, so we can write down things. And I will have patients write themselves a permission slip, and write out a sentence, that I have permission to have pleasure. A very simple sentence like that is so incredibly powerful. And then I have them put that sticky note or that card anywhere they're going to see it. So what is something that they look at every day? Is it their computer? Is it their phone? Do they need a little pop-up on their phone, and a reminder every day that says, I have permission to have pleasure? And when you start thinking about those sorts of things over and over and over again, it starts to be part of your daily routine, your daily thoughts that you're going to. And every then act that you do leads towards that pleasure. And being able to think about that piece of it. So any decision you're making, is this going to bring me pleasure? Or am I going to not really want to do this? And if I'm not really wanting to do this, why is I not wanting to do this? Is it just because it's a task that I have to do every day? Or is it because I feel icky, because I get an upset stomach, because it's a visceral reaction of this activity that I'm doing? So again, how do we reframe that? What are those icky feelings and not feeling really good? What's not bringing me pleasure? And then we can make a list of those and then tackle those too. Language really shapes power. So one of the things that I encourage people to do is you're shifting from the negative to the positive. So again, this can be an example like, what is wrong with me, to what does my body need right now? And that's going to be really powerful. So when we think about in terms of what can I do maybe differently for my partner? Now, what is it that I can do differently for me? So again, changing all of that language to have more of a reflection, rather than thinking that, again, something's broken, something has to be fixed. That is not here at all. So again, being able to shift that. And then when we talk about partner dynamics, this is going to be in your relationship. We know that pleasure thrives when there is adequate and optimal communication, when there is equity in the responsibilities, and when there is a mutual curiosity. And so again, this can be working with a sex therapist. It can be great to invite the couple's work. But these are other things that you can look at and reflect on, is what is my communication type? How do I communicate? Do I feel like I struggle getting out what I need? And so I role play with a lot of my patients so that we can at least help set some examples and to give some context around what this could look like when they're having a conversation with their partner. Menopause, again, this is not the end. This is a recalibration, and sometimes a celebration. It's just a new phase of life. So new hormones, new boundaries, and new permission giving. And then what I see when pleasure is reclaimed is that there's less pain. The nervous system is not as upregulated. We're having more parasympathetic, more rest, digestion, safety. A lot more confidence. Confidence is one of the most fun things that I love when I walk into a room and my patient is so excited to tell me, I did it. I created boundaries. I feel more confident in who I am. I feel confident in asking for what I want, and that has really strengthened my relationship. One of the things that people get nervous about is that they will say that I'm really concerned that my partner's going to leave me if I start creating these boundaries, if I start having more confidence. And we have to really then start to explore whether that relationship is supportive of who they are and why are they staying in that relationship. And those can be tough conversations, but are much needed ones. And then I love this too because it's unapologetic, right? Unapologetic often comes across as what people think as being aggressive, but it is not. Being unapologetic means that you're being honest with yourself and the relationship in your partner. You are defining who you are as an individual. And then again, most importantly, it is rooted in consent. And again, consent is non-negotiable in my eyes. So to kind of wrap us up, this is a little invitation for you all listening to this. And I want you to ask yourself these following questions. Where have I minimized my pleasure? And this is everything. I don't want you to just think about this on the sexual health side of things, because if you start assessing the other types of pleasure in your life, the sexual health piece will come very easily and naturally. So where have you minimized pleasure in your life, in the daily basis, at work, at home? What would change if I trusted my body? It's a really fun one. And then what feels like a gentle next step? Remember, these don't have to be big jumps. They don't have to be huge manifestations or writing things down or completely change anything. When we start looking at little baby steps and what you can do to help keep yourself moving forward, it's these little things on a daily basis. What is something like 5 minutes that I can do for myself every day? Maybe instead of having coffee with the family or trying to get breakfast ready all at the same time, that I'm taking 5 minutes for myself to just drink that cup of coffee. And I'm also going to say, if somebody comes up to me and says, oh, hey, can you help me with whatever task I need? I will help you in 5 minutes. Right? Start creating. You didn't say, no, I wasn't going to help you, but you were establishing boundaries that what I'm doing right now is really important. And if somebody says, well, you're not doing anything right now, and you can say, yes, I am. I'm doing something for myself. They don't have to know what it is. You don't even have to give them an explanation. Just say, actually, I am doing something for myself right now, and I will get to you when I can get to you. And so, again, setting those boundaries and having some of that buffer time can be helpful, but very difficult to articulate if you've not done it before. So again, finding little things to do can help give you that confidence to keep moving forward. And one of the things, and this is kind of, again, your mantra for tonight is to remember that pleasure is not extra. Pleasure, it's informed, it's power, and that it is yours. So I hope that, again, this is your, again, permission slip to have these conversations with yourself, have these conversations with your partner, and know that pleasure is non-negotiable and that you deserve it.
Awesome. So many good things in there, definitely. And don't you think it's interesting that we have to remind people that you don't have to apologize for wanting and needing and showing up powerfully, wanting pleasure, right? There's nothing to apologize for. But I do think so. I think you really articulated nicely that balance between, um, between reclaiming your power, reclaiming your pleasure, um, and then at the same time, you know, navigating your way through that, is your true self, as your authentic self. And so I think there's a lot of things to think about with that. But yeah, I thought there was a lot of really good information in there. And I love the thought of your authentic self has nothing to apologize. When you show up, your loving, beautiful self has nothing to apologize. So don't be shy about it.
Mm-hmm. Yes. What makes the worlds are beautiful. I love the diversity that we have, and to feel like we should be like somebody else really is not doing the world justice. And you are holding back your gift to the world. And I also think about too, when you have children or you have other individuals who are looking up to you as being a role model, or being in some situation. If they're seeing that and they see that it's okay to put somebody else first, or that you continue to make sacrifices on yourself, they're going to think that that's okay, and then they are going to emulate that when they grow up. And think about this, right? I have 3 girls, 3 kiddos who all identify as female right now, and I want to create an example for them. I want them to know that they have a voice in their relationship, that they can put themselves first, and again, that it is not selfish, it is self-full. That they should never apologize for their wants, needs, and desires, and that it's okay to ask for what you need. If you need a moment, if you need to step away, I can't do this. No is a complete sentence, and I think I've heard lots of celebrities say that over the years, but that's huge, and it's not something that is celebrated if you are a, again, female presenting person. It is, you have to put everybody else first. I will never forget when I was coming back from maternity leave with all of my kiddos, all of my patients, were just like, oh, you must be want to, be at home with your kids, or you must want to, just be at home with your family. And I'm like, no, I don't want to be at home with them. I love them dearly. But what gives me pleasure and my passion is being with my patients, is being with them. And not that there is a hierarchy, but when you really start to find where you minimize that pleasure. And if I lost having those experiences with my patients, or even being able to, because a lot of times it was the women, it was my female patients that would ask me that. And it gave us a great opportunity to say, oh, well, what messages did you have growing up about your pleasure and your passions? And when there was silence, it meant that there was not an opportunity. And so being able to reframe it and thinking, okay, well, how do I get that opportunity? And it's never too late. I think that that's another myth is, oh, it's too late for my pleasure. Oh, absolutely not. Absolutely not. That just means we have time to make up for it. It's part of it. So.
Yeah, and so again, I love the authenticity message, and all of us showing up our true loving self, our authentic self, not our trauma, not our drama, but our authentic self. And then also, I really like how you talk about, I think so many women and men sometimes too, have difficulty believing that they are worthy of pleasure. They want to help everybody else, make everybody else happy, but what about your own pleasure? And that you talk about, it's not just sexual pleasure. Do you allow yourself pleasure? Do you allow yourself pleasure in using your senses, in eating, in a massage? Do you, simple things, do you allow yourself the luxury of pleasure and joy? And so I think that's a really important thing for people, our listeners, to think about. Are you, because so often with my patients, and I know you do with your patients too, I'm like, you take such good care of everybody else. What about you? Could you please, for just a minute, turn that care on you? If you do that self-care, which self-care, there's nothing selfish about self-care. If you would turn that on you, it could change everything. You're so good to everybody, but what about you?
Yep, exactly. And then being present in those pleasurable moments. I think we let them go by too fast. And so being able to pause and actually say to yourself, I'm really enjoying this. And then also say, why am I enjoying this? So these little tiny things that you can reframe and going, I say coffee because I love coffee, and I love that. That's my pleasurable moment, is that first sip of coffee. It's so it's my whole day, and it just is really exciting. And I sit there and I'm like, God, this is just so good. And then thinking about, what is it? is it the taste? Is it the warmth? Is it the smell? Again, the senses. And so when you start to layer in what is it that you love about it, you start recognizing that with everything. And again, we rush too much, and we never want to rush pleasure, right? You want to sit, you want to steep in it. Like you just want to have this lusciousness of what's happening, and that you can have that with coffee, with foods, with a sunrise or a sunset or a smell, or watching an activity that you get a lot of pleasure in.
Infusing it with mindfulness, taking moments to mindfully eat, to mindfully drink, to mindfully be in every moment. And they say, all we have is this very moment. So are you fully present in this moment and experiencing it? And it's hard because we live in a society where like, okay, I got to think about what's next. I got to pick up my kid at and all the different things. But can you stop and mindfully eat? Can you stop and mindfully, whatever you're doing? If you can put pleasure and joy, this moment is what you have. And if you can put it in there, it changes everything. It's powerful. And then I think too, I love how you talked about comparison and how that's a real joy killer. It's a soul killer, right? When you compare. Everybody's unique and fantastic in their own way. Celebrate you. Celebrate this moment for you. And I love how you approach the coffee. Very mindful, very present. And then it's like you savor it. It's a wonderful, wonderful thing. I do think boundaries are important and consent too. And I was kind of thinking about what you said about consent. And I wanted to remind listeners, and we've said this a couple times on the podcast, but I would really like to remind you, consent is an ongoing dynamic process during sex. It's not a stop-start. It's not a one-time yes, but a continuous and hopefully enthusiastic agreement that must be checked in on at every stage, can be revoked at any time, and it requires clear voluntary communication, not just the absence of, no, this isn't right for me. It needs to be an enthusiastic yes. And it's an ongoing process.
I'm sorry. Yeah. And if there's any hesitation, so I always tell people, if there's any hesitation, you really need to take a pause to figure out if this is something that is, again, this enthusiastic piece to it. And if there is any question, that's a great opportunity for you to raise that question with yourself or with your partner and going, something just doesn't feel right now. Can we take a minute? Can we come back to this? I'd like to take a pause. You can totally take a pause. Just because you stop an activity doesn't mean you stop it forever. And I think that is, we get so literal sometimes, and it's not, and nobody should take offense to it. And that often happens when we're confused about what's happening. So being able to use your word and just say, I'm not feeling, and owning it, right? I'm not feeling, something feels off right now. I really would like to take a pause. Yeah, and let me come back, and I will come back when I am ready, right? Rather than letting and saying the partner is the one. If you're the one that's taking the pause, take ownership and say, okay, I will come back when I'm ready.
Yes, and that can happen in sex, in intimacy, in conversation. Taking a pause can be a powerful thing. Let's step back. Let's breathe into this moment. Let's think about it. Is this where we want to be with it and stuff? And again, it's without judgment. Just wait. I'm feeling something different right now, but I think it's a good thing to remind people about and really important. Oh, we could talk about this all night. There's so many good things, but let me give you the first question I had for you from listeners is, many of us were raised with messages that pleasure is selfish and shameful. What are some practical ways to begin unlearning those beliefs while still honoring our values and relationships?
The first thing is to identify, where did that message come from? Was this something because it was a family value? Was this a cultural value? Was this something from a religious side of things? I think understanding where it comes from. I'm a big, where is this rooted in? And where were those individuals coming from when they gave you that message? Again, I often think about generations, right? That, again, I have this with my grandmother when I had conversations when she was still alive. She often said to me, I wish I would have known that I could have done things differently. But because of the time that she was raised, that's what you did. You took your husband's last name, you had the kids, you stayed at home, and she didn't realize that there were other options. So I think understanding, my grandmother was very open, obviously. Oh my gosh. You see where I came from. I'm a tenacious person. I come from a very strong-willed female line. But that was, I think, having that conversation with her was really eye-opening, because there were some things that she questioned when I was growing up and why I did things. Why did I want to be in the medical field? Why was I wanting to do this? Like, did I not want a family? So I think this gives you an opportunity to have a curiosity lens, and asking, where did this come from and why? And then going to that person, if you feel comfortable doing that, or going to those messages, whether it's, again, your culture, your family, a religious institution, and saying, can we have a little bit more conversations of where these messages came from? And I'm having a hard time understanding why we would want to not have these conversations, or why that we're not celebrating at all individuals. And if it doesn't align necessarily with what you are now believing, it's okay to respectfully disagree on those values and messages growing up. I think a lot of times people want to show respect, and will say, well, I don't want to hurt my culture or hurt my family. And this is where, as a female identified individual, a lot of times you stay the path, you don't deviate from it. And this is where saying it's okay to respect your family and respect the beliefs, but you now have to put yourself first. And putting yourself first means honoring your curiosities, honoring the questions that you're bringing up and why you're feeling this way. And if you are okay with those cultural messages, that is something that you still, or whatever those messages were, that is where now you need to have an understanding that, okay, I have to be okay with what this looks like moving forward. And that if you're not getting pleasure out of something, that's something that you have to be okay with after you've explored where that's coming from.
Yeah, I think figuring out where it's coming from, because so much of the voice in your head and the negative thinking comes from a culmination of past traumas. And so identifying those can be really helpful. And then too, remember, if it created some sort of shame, you need to challenge it a little bit. Challenge it and unpack it and see what it's about, and is it really true for you? So I think those are really important messages for our listeners. Another question was, for women who feel pressure to perform or please a partner, how can pleasure become something that's for them again, rather than another expectation to meet, another box to tick?
Yeah. And a lot of that, again, has to come internally, and knowing your self-worth. And that can take some time in order to figure that out. And the first step is to acknowledge it. So if you are the person who is asking that question, good, because asking the question is that first step. And then again, thinking about finding pleasure in those other small daily activities. Start there first, and then start to build into more of the sexual intimacy side of things. I often, one of my patients, we were talking about this, and we were talking about intimacy and sexuality, and she said, I just feel like that's jumping into the deep end, and I don't know how to swim. And I said, exactly, and that we need to have some baby steps, and we're going to play in the baby pool for a little bit and get our footing, and then we're a little bit more comfortable to go into the shallow end of the pool, and then start making our way. And so when you get more comfortable, which is why I always start with these tiny baby things, and something that you do every day. And that's one of the things that I will give homework to my patients to, and say, okay, I want you to find, and you don't have to make the change, but I want you to think about what is something every single day that you want to find pleasure in. And then they come back and we talk about it, and I say, okay, when are we doing this? When are you starting? Right. And then so the next step is making a timeline to implement that and take that next step forward. And then the next thing would be to journal about it. Write it down. How did it make you feel? Did it make you feel really awkward the first time you did it? Because that's what I hear a lot of times. It felt weird. It kind of felt that I was forcing it a little bit. Okay, well, if you feel like you're forcing it, what is it that we can do to make it feel a little less forced? How we can make it flow a little bit more into your daily activity. Maybe you thought too hard about it and you went too far in the other direction. So let's back it up just a little bit. And so those are like great things that you can just do to start that conversation with yourself on where do I really want to start pleasure. But it is, again, you have to know that you are worthy of pleasure, and that you are worthy of this conversation and the curiosity, and that you also deserve better, and that you need to surround yourself with people who are going to support you through that process.
Absolutely. Great words. Shame makes you believe you are unworthy, but you are so inherently worthy. And I think that's the really difficult thing. Shame is really problematic. It's one thing to feel, to reflect and look at yourself and be self in a good constructive critical way of yourself, but it's a whole different thing when you feel shame, and shame robs us of worthiness. So I think those are some really good messages. Well, I think that leads us really well into our centering exercise. I'm going to go to my centering exercise, and then I'm going to talk about next week's podcast and come back to you in just a minute, Aleece. So, yes, as we always do, wow, so many good words to think about. Showing up authentically, really being your real you, making sure boundaries are in place. Love requires boundaries on every side so that no one gets hurt, no one gets upset. Boundaries are healthy, boundaries are good. And consent is an ongoing process. So many messages in there, really good. All right, so before we close, I'd like to invite you into a brief centering moment like we do here. One that honors your body, your right to pleasure. If it feels safe, gently close your eyes or soften your gaze, whatever feels comfortable to you. Take a slow, deep breath in your nose and a full breath out through your mouth. As you continue breathing deeply that way, bring your attention to your miraculous body. Not to fix it, not to judge it, not to analyze it, just to notice it with curiosity, as we said earlier. Curiosity. Now bring your notice in your body as you're breathing deeply. Where do you feel warmth? Where in your body do you feel warmth? Notice where you feel softness. Notice where you feel strength in your body. Where does strength reside? Place one hand over your heart, and if it's comfortable, one hand over your lower belly or your pelvis, either one. Breathe in the nose, gently exhale through the mouth. Feel your breath as you continue to breathe move between your hands. As you continue to breathe, silently repeat to yourself, or you can do it out loud at home. My body is wise. My body is wise. My pleasure matters. My pleasure matters. I am allowed to take up space in my own desire. I am allowed to take up space in my own desire. I am enough and I am worthy. I am enough and I am so worthy. Take one more slow breath in and let it go. As you move back into your day, carry this truth with you. Reclaiming pleasure is not about becoming someone new. It's about remembering who you already are. Now, Vic, can you tell us What's up next week on Dr. Jeff Talks About Sex and Intimacy?
Peyronie's disease and penile shortening can deeply affect a man's sexual function. They can also impact self-esteem and intimate relationships. In this episode, Dr. Jeff is joined by urologist and inventor Dr. Landon Trost. Dr. Trost is the creator of the RestoreX penile traction device. Together they discuss how evidence-based traction therapy is changing treatment options. Dr. Trost explains how RestoreX works. He reviews the clinical trial results. He also shares why this FDA-registered device has become a leading non-surgical option for reducing penile curvature, restoring lost length, and improving overall sexual confidence. Join us on December 30th at 7 p.m. Central Time to learn more.
I hope you'll join us next week. It's going to be an exciting talk. Dr. Trost is a great speaker, and this thing that he invented is one of a kind. So I'm excited to hear more, for you to hear more about it. I've heard more about it. Aleece has certainly heard more about it at Sexual Medicine Society. So we've learned a lot of great things we want to share, and so I think that'll be a great episode. But today, wow. Gosh, Aleece, thank you so much for joining me, for sharing your expertise and all your thoughts, and helping women reclaim their pleasure and their power, which they're so deserving of. And I just thank you so much for that. And is there any final message you'd like to tell our listeners as we close out our episode? Uh-oh. Oh, unmute yourself, Aleece.
Oh my gosh, right? How many times have we done this? No, just thinking about what you were asking, what you're saying, how these final things, and what was in my brain is one of the things that I always say when I am a guest someplace, or even with my patients. I will always say, it's my pleasure. And so I think that really just, again, I find so much pleasure in educating, having conversations, empowering women. And so it is my pleasure. And thank you so much for having me tonight.
It was my pleasure as well. So, and most of all, it was our pleasure, listeners, to have each of you here. Thank you so much for joining us. It means so much to us. And my hope and prayer for you is that you regain and reclaim the incredible pleasure and incredible power that you have in your life. You are inherently worthy and miraculous. Thank you for joining us, and have a good one.
As Dr. Jeff talks about sex